Someone just kind of thinks they're healthy because their doctor never told them anything's wrong, but really they kind of feel lousy. They're tired. They have that 2 o'clock blood sugar craving. They're reaching for candy at 2 o'clock. They're not productive. They've got headaches. They're fatigued. And no one ever told them why, or that it's not normal.
What happens when a doctor stops accepting that's just how healthcare works and builds her own solution? Dr. Erica Armstrong is rewriting the future of worker health by treating root causes instead of symptoms, saving lives, money, and dignity. Dr. Erica Armstrong is a board certified family physician who walked away from the constraints of traditional healthcare to build something better. Root Functional Medicine, a virtual clinic built to find and fix the real causes of chronic disease. She didn't set out to create the nation's leading root cause health platform, but she kept seeing patients whose lives were quietly breaking down because the system only treated symptoms. At Root, she leads a national care team and a proprietary platform, Root OS, that uses data, personalization, and human-centered care to help people actually get well. Her path into this work began with a frustration. She could see what people needed, but the existing system wouldn't let her practice medicine the way she knew it could be. The emotional core of her story is simple and universal. She believed workers deserved health, dignity, and energy, not a lifetime subscription to medications and suffering. Today, she partners with employers to rebuild the health of the American workforce, one person and one root cause at a time. So please welcome Erica Armstrong to the Manufacturing Culture Podcast. Welcome, Erica. How are you doing today?
Thank you so much, Jim, for having me. That was a wonderful intro. I think I'm going to need that script for future reference. Thank you so much.
Yeah, you're very welcome. So, Erica, you're, like we were talking about before I hit record, you're a little bit of a departure from our normal guest on here. But what drew me to you is your focus on the American workforce, right? And the struggles that they go through, but also the fact that you're looking for root causes, right? And in manufacturing, so often we do root cause analysis to try and find why we have scrap, why our machines aren't running at capacity, all those kinds of fun things. So I really think there's a really cool crossover, and you have manufacturing clients. So I'm really excited for this conversation today. We're going to start out by having a whole lot of fun, though, because my icebreaker, I don't even know if I prepped you for this. The first icebreaker is, if your life were a movie, what genre would it be? Who would play you? And what's the opening scene?
I would have to go with comedy. I mean, I use sense of humor as a coping mechanism, I'll admit. Life's not always easy in startup. And yeah, we have a great team who, where appropriate, we can laugh at ourselves. Who would play me? Oh, gosh. Well, I don't want to sound like I actually think that, she's like me or anything, but I think Cameron Diaz just has a great personality. But
okay,
yeah.
I like it. And what's the opening scene of this?
The opening scene is probably me trying to balance something with my kids and work.
The mom life. I get it. Absolutely. And we were just talking about, as we go into these holiday seasons, the balancing that parents do, but especially moms. And I don't have any kids who listen to this. So mom is Santa, everybody out there. It's not some dude in a red jumpsuit. It's the moms out there. So thank a mom for Santa gifts. And yeah, I love your answers. Those questions give us a really good snapshot of how you view your world, right? And so thanks for sharing that with us. Erica, the next question is a little bit more serious, right? It's about your view of culture. So what is your definition of culture? It's a manufacturing culture podcast. We got to talk about culture a little bit. So what's your definition?
Yeah, I mean, one of the reasons I reached out to you, Jim, is that I think health and wellness are a big part of culture. And so we have to provide a situation for both physical and mental health, the two are connected. And when you have happy, healthy people, I think that's the foundation for a good culture.
Yeah, absolutely. I agree 100%. And I'm going to have to put that on like a mug or something. That was a good answer.
Thank you.
So let's talk about Dr. Erica Armstrong a little bit. What was the moment that you realized that you weren't didn't fit into that traditional healthcare mold?
Yeah, great question. So I was practicing family medicine and, I was in a hospital owned practice and things are fast. It's almost like a treadmill. You're moving through lots of different questions for every person that you're just like, okay, symptom, medication, referral, procedure. And it's like just this really fast, trying to do as much as you can for the person in front of you and doing the things that you were taught. And it was kind of over the years that I saw a pattern. It wasn't like one aha moment, it was this pattern of like, actually, now what's happening is my patients are kind of getting escalating number of medications and escalating doses, and I'm not really sure that they're feeling better. I think I'm controlling their numbers with this, but are they actually feeling well? And the other challenge that I experience as a family medicine doctor is when you're in family medicine, you're the front lines. You're the person they call first, but you're also the last resort. And so sometimes when I had more challenging cases, people who weren't getting better, they were kind of bouncing around. They would have a stomach doctor for the stomach issues, a dermatologist for skin issues. And sometimes they'd have to wait months just to even get into a rheumatologist if we were suspecting an autoimmune condition. And they'd end up back in my lap and say, what can I do? I want to take, like, I want to be empowered. I want to be able to do something to feel better. And I was like, that is a really great question. I wish I had more, tools or education around like what you can be doing and what I can be doing as the doctor to put this picture together for you. And I actually learned about functional medicine back in 2016. I've been learning and practicing this for a while now. And as I started to piece it in, it just made so much sense. So I guess let me just stop and tell you the definition of functional
Yeah,
medicine.
please do.
And so there's a lot of different types of practices out there. At Root, our team is board certified MDs and DOs and dietitians. So you have a medical expert and a food as medicine expert. And they've gone to additional training and experience in functional medicine, which is, in our definition, looking for and treating root causes. That's why we're called Root. It's a
Got it.
big part of functional medicine. And so we do more advanced testing and we spend more time with people and we put the picture together for people. But in this transition, what was happening is I pieced it in as much as I could in my conventional setting. And ultimately, I knew I wanted to practice this way and I needed a dietitian as my partner. There's
Mm,
not usually dietitians in a conventional primary care office. And so we set out together and we created this model of Root that we still use today. We've scaled it up quite a bit. We were working with individuals before we started working with companies.
okay.
So yeah,
That's awesome.
that's the long story.
So was there like a single patient or a moment that pushed you into this where you're like, I can't do this anymore. I have to build that better system?
It was this constant gnawing in my stomach. I would feel it before work and I'd be like, I just don't know. I always wanted to be a family doctor since I was young.
Really? So you knew this was your path for a long time.
Yeah, I wasn't just going to be a doctor. I was going to be a primary doctor in the community that knew all of my patients and I loved that part of it. It was just that like because I cared deeply about them, I needed to help solve their problems.
Yeah. Yeah. And I mean, you see this all the time where, I mean, I have a referral over here for something that I have to go take care of, right? But I am 3 months out from being able to see this other referral or this other doctor that I was referred to instead of just being able to go see the one doctor that says, "Hey, here's the issue, here's your root cause." And so you kind of help people navigate that healthcare system as well as their own health issues, right? I mean, is that part of it is navigating instead of having to send people to different areas?
Oh, for sure. And so at Root, we actually treat the same conditions that a primary doctor would, even though we don't do primary care. But a lot of what we do is actually translate those short
Mm,
specialist visits. Sometimes there's like 4 or 5 of them, and they're like, this person said this little thing and this one. And like, how does that add up? And just kind of putting that picture together and say, well, actually, like, your hormones are affecting your autoimmune condition. Maybe this actually started in your gut with inflammation, and maybe your gut is actually the source of all of these other symptoms. And so now they have one clear answer instead of 5 different specialists and one clear plan, and they know what to do. So that's part of the secret.
I love that. So, how much did your background as, a board certified family general practitioner or family physician, sorry, not general practitioner, shaped the way that you approached creating Root itself?
Yeah, I think it's really important. And I think the first thing that we do is try to establish if there have been missed diagnoses. So, for example, like if someone has autoimmune conditions but uncontrolled, we want to see like, was there a gluten allergy missed? Like, do you actually have celiac disease as a trigger? And amazingly, a lot of people make it years without knowing that piece of it. And so I think having that background to say, actually, maybe there's like an actual medical issue that's not been uncovered. That's a big one that we do. Also for like hormone imbalances, we'll find a, a diagnosis of PCOS sometimes, polycystic
Okay.
ovarian syndrome, or we'll find like thyroid diagnoses. So that's important. So we have to not miss things. We have to be able to interpret lab values too. So we do more extensive lab panels and knowing what's actually critical, what needs a referral versus what just needs to be optimized. So that's an important piece of having the physician background. But I use it for those first pieces, and then everything from there is like, what do we do in our root functional model of care? What is the treatment plan is very functional.
Got it. And so, I mean, knew you needed a dietitian or wanted and needed a dietitian. And you've brought up, food a couple of times in the short time we've already been recording. How often is, that biome, that gut health, the food that we intake affecting our health overall from your perspective?
Oh, it's so important. That's why I knew I couldn't practice functional medicine without a dietitian. Our first line of treatment is nutrition. So
Really?
once we put the picture together and figure out what's going on, the dietitians are really the ones guiding the treatment plan. And we can customize diets too. Like somebody has an imbalance in the microbiome. These certain foods feed the microbiome this way, and other foods are more inflammatory for you, or you have these food sensitivities. So the dietitian really takes a lot of this noise that's not personalized, that's out there, all these different diets you can try, right?
Absolutely.
That aren't considering you as a unique person with unique physiology, and they help guide that.
Got it. I mean, yeah, you hear, there's paleo, there's so many different dietary ideals. 17-day diet was big a decade ago, right? All these things where people may not be taking their own self into the equation and saying, well, I don't like the cruelty to animals, so I'm going to be vegan now or vegetarian, right? And are you saying that their personal chemistry, that could be potentially be a bad choice for them? Or is there one diet that you're like, if you were to choose one thing, this would be the best way for you to go? And this is for my own edification because I'm a middle-aged overweight white dude that literally will shovel pizza in my mouth after we're done recording here. So tell me about that kind of choices that we make.
So first of all, I love the honesty and transparency. That's important for making changes. So thank you. I think the biggest thing I'll say first is it's not a diet, actually. A diet has to be something you can sustainably do. Otherwise, you'll be in 2 weeks into the Whole30 diet and you'll just give up and you'll go like way back to eating pizza all the time.
Yeah.
So everything that we do is sustainable. So that people can stay on track and they can actually do it anywhere. We have construction companies who work with us and they're eating on the road. And the biggest thing that would help anybody is to balance their blood sugar.
Okay.
So that will make anyone feel better because no one likes to feel hangry, and blood sugar imbalances are so common. You don't have to have diabetes to have a blood sugar imbalance problem or prediabetes. It happens when we don't eat the right protein, healthy fat, and fiber in each
Okay.
meal and snack. And so that we teach our people the same method we've used in practice for years, and we teach them how to balance their blood sugar anywhere that they are.
Wow. That's really cool. And so because you're looking at, protein, healthy fat, and I forget the third one, carbohydrates?
Yeah, carbohydrates are fiber.
Fiber. See, this is how little I know about, and I am married to very healthy eater, which is that yin yang of life. But so you can say to somebody who is vegan, here's how you eat vegan but balance your blood sugar with this protein, this high fat or healthy fat and fiber, right? Instead of saying, hey, protein is only delivered by this one source.
Sure. I mean, people have personalized diet and cultural diet preferences, and that's okay. We meet people where they're at. We can help optimize that and also check for deficiencies. So, very common deficiencies like B12 and omega 3 and iron and so on and so on. Make sure we supplement those to help them feel their best.
Awesome. So I'm imagining a lot of my listeners and myself, before I talked to you, had never heard the term root cause medicine, right? So walk us through the process from walking in on a first appointment to seeing the results that you deliver for your corporate clients or individuals.
Yes. So individuals go through a very similar process that a corporate sponsored member would go through. And the way that we start is actually starting with labs. So you walk into that first appointment with the right data in hand to maximize your time instead of the conventional route of like going in, getting things ordered, waiting a few weeks, going back in. We speed that all up. Like you were saying, time to your referral is months down the road. We cut all that extra waiting time out for answers by starting with labs.
I love it.
So they'll have that, and they go into Quest Diagnostics nationwide, pop in and out. It's super easy. Everything's automated as far as sending the order over there. And then on their first visit, typically the first visit is with the doctor. It doesn't have to be. Sometimes, they do want to see the nutritionist
Hmm.
first, and that's fine too. But in the first visit, we're going to break down those answers. Some people already had labs and they're coming in with those as well, but they didn't really get a clear Q&A session, about them. And so we go over that, we go over their history, we figure out, is there anything else we need to investigate? And from there, we start some of the wellness planning. And so that's a referral to see the dietitian next. We'll give some of our basic nutrition guidance that the doctors don't have as much training as the food as medicine experts, but we've been working with them for years, so they rub off on us.
Yeah.
So we'll give some of the core things they can get started with before their dietitian appointment. We'll replace deficiencies we find in the labs. Based on their symptoms, we may recommend some microbiome testing, especially if they have gut health issues or autoimmune conditions as a next step. And then they're working on, replacing nutrients. They're working on balancing their blood sugar. They're following our resources on our platform. And a lot of times, that is the biggest thing that gets them better right away. Unless we find deeper issues, like we need to go in and write a hormone prescription, or we need to clear up the microbiome. So that path is personalized based on what we find in the first two visits, but the first two visits will help anybody.
Yeah. Awesome. I love that. And so what's a benefit for a corporation or a company, right? So I have, hypothetically, right? Of course, I'm not saying I have this company, anybody, but hypothetically, I have a company that has 40 employees. We're a machine shop. What's the benefit that as a corporation I can see, or a company I can see, by partnering with Root Functional Medicine?
Yeah. And so I would do a little discovery process with you just to figure out what your either challenges or goals are as a company, because some companies are self-funded, meaning they're paying, and that's very common in manufacturing. You probably have lots of listeners of self-funded companies. That means they're paying all of the medical claims instead of just paying an insurance premium.
Okay.
Yes. And so those folks are very interested in cost reduction because
Yeah.
sometimes it's one of the top expenses on their P&L.
No
And so
kidding.
for that, we want to devise a program where they do work with us one-on-one, because that's where the ROI is.
Hmm.
And so we want to make sure to include those doctor and dietitian visits, especially for things like gut health issues, autoimmune conditions, hormones, migraines. Those are kind of the top. Usually when I look at claims for the larger companies, those are the top drivers. And then the fifth one is always medications. Almost half of their cost is medication. So that's either autoimmune or GLP-1s for diabetes. Those are usually some of the top. Migraines are in there too sometimes. Yeah. So the goal might be ROI. So for them, we're going to want to work one-on-one. Another goal a company might have is we don't have a wellness program. We don't have any biometric screening. And last time I tried it, my people didn't really do it. They didn't get a lot of value out of it. And I get that because I remember what traditional biometric screens are. It's like a finger prick, and then you get your two numbers written down and you're sent off on your way with no follow-up or action plan. And so we can definitely replace and enhance that. And we would make it more interesting for your employee because they're now going to get access to data that typically their primary doctor has not ordered. They're
Mm.
going to get our doctor's interpretation and nutrition advice and resources. And we engage them throughout the year too. It's not just labs and advice and done. It's like, okay, we have a challenge coming up this month. We're going to make smoothies and we're going to balance them, not making high sugar smoothies, or we're going to do a meal prep challenge, or we'll see you in the community every month so you can ask us questions. So it's a very engaging wellness program that includes that biometric screen.
Awesome. And what's the benefit to companies that start treating a wellness program as part of their infrastructure instead of a perk, right? Instead of like that infamous, pizza party or a ping pong table in a break room, right? What happens internally with the culture?
Sure. You've probably been familiar with this kind of situation before. Someone just kind of thinks they're healthy because their doctor never told them anything's wrong, but really they kind of feel lousy. They're tired. They have that 2 o'clock blood sugar craving. They're reaching for candy at 2 o'clock. They're not productive. They've got headaches. They're fatigued. And like no one ever told them why. Or that it's not normal. It's not normal to feel like that. I mean, your coworkers might be feeling like that too, but that's not normal either. Now you have information that you can sometimes make quick, simple changes from that blood panel. Like, actually, your vitamin D level is so low, and that causes fatigue and inflammation when that's low, and mood issues, or your B12 is low, or oh, your blood sugar is creeping up there. That's why you're hangry at 2 o'clock. And so let's give some people some quick answers and what to do about them. That is going to overall benefit the company in many ways. One, early detection and prevention of disease. And then two, like how you actually feel every day. And then the third one I haven't hit on yet is absenteeism.
Mm.
So we've worked with companies who have people with migraines or IBS. And for these folks, sometimes they're missing a lot of days of work every month because migraines are tough. And sometimes they end up in ER or different specialists. Sometimes they end up with injections or IV meds. And when we fix the root cause, we've seen migraines go from like 11 days of work a month to 0. And so that's huge for the person and for the company because their coworkers are relying on you and they don't want to miss work. They don't want to be home with a migraine. So again, like happy, healthy culture is productive and it's good for everyone.
Yeah. Do you think that, I talk a lot about rebuilding the middle class and how manufacturing was once that foundation for for the middle class. Do you think that better health outcomes can rebuild the middle class and the stability that the middle class has, especially when the majority of Americans are like one illness away from bankruptcy? Like, is that something that can help build that stability with our workforce?
I mean, absolutely. I couldn't have said it better than that. One illness away from bankruptcy. Healthcare costs are a huge out-of-pocket expense for people. And if we can reduce that even slightly, you're getting more buying power for your other essential needs too, including groceries.
Yeah.
Yes, so healthcare is foundational to rebuilding the middle class. And not only in the cost of it, but how you're able to enjoy your life and be productive when you feel healthy.
Yeah. And I mean, functional medicine, just in what I've researched on this since our conversation, is sometimes viewed as like elite or inaccessible for your average everyday human, right? How does root functional medicine and root OS make it practical and equitable and for your everyday middle and working class person?
Yeah, I'm so glad you asked that. Working directly with employers is the biggest way that we enable access to people, whether it's socioeconomic or just even knowing that this kind of care exists. A lot of
Hmm.
people who start work with us, they don't know what functional medicine was or how it can impact their life. And so I think that's one of the biggest ways. But we work with people from all walks of life. The other thing that you mentioned was Root OS, which is our technology. And that makes it much more scalable. Like most functional medicine practices, they have like a max of 200 patients
Mm.
per clinician. So they're very small. And so those small practices tend to have to be expensive because they don't see as many people. It takes longer. They don't have the technology built in. They don't have all our protocols, our team support. And we make it more accessible cost wise by having all of this stuff built in and being a more scalable model.
For me, I think So I have another show. It's called The Manufacturing Connector. It's a show where software companies are able to do demos and hardware companies can like show their tools and all of that kind of fun stuff. I think that you and I need to have a second episode here, Erica, where you demo Root OS for
Oh, that
us. That way, people can see what that functionality would be if they were to invest as an organization, right? We have some owners who are listen to this show, and I think that it would be really cool for them to see what is that OS system look like? How do I incorporate it into my day-to-day practices? And like you've said, you've got a lot of, I don't know if a lot, but you said you have manufacturing clients, so I think, or in patients. So I think it would be really cool for other people to see exactly how you do that. Is that something you'd be game for?
absolutely, that would be great. We
Okay,
can
cool.
bring one of our engineers on the podcast too. He's probably better at explaining
All
some
right.
of the technical things for that audience.
All right, perfect. Yeah. It's a much more technical audience. I things fly over my head all the time, but I'm just the guy who asks questions.
The clinical brain of our team. So yeah, that'll be
I
a
love it.
nice, yeah.
I love it. So those corporate clients, those company clients, they come to you and they say, "Hey, I want to, provide this wellness program for my employees. We want to use Root. Where is Root? I mean, is this something where you're a clinic in one city and you can only serve that, or is it something where you can serve a broader client base?"
We can serve a broader client base. Our headquarters is in Grand Rapids, Michigan, but our docs and dietitians are throughout the US, and everything that we do one on one is virtual. So it's easy. You just click a link on your phone or your computer, and it's a telehealth visit. We have clients all over the country.
Awesome. And I mean, I wish I had put two and two together. I was in Grand Rapids over the summer. I would have loved to have connected with you over a cup of coffee or cocktail or whatever your beverage of choice is. Uh, and I have a lot of friends who are there in Grand Rapids. But I love that you are able to serve a broader base, because one of the things that I see not only is manufacturing in these urban areas, but a lot of the manufacturers who potentially have higher health issues are going to be in more rural areas. I mean, I was in a small town a couple of weeks ago, and again, I'm an overweight middle-aged white dude, right? So I'm nowhere passing judgment on the people I saw, but the perceived level of obesity in this one facility was astronomical. And when I was talking with people, they're eating, barbecue, they're eating pizza, they're not necessarily eating the best food for them. They're eating what's accessible. And I think that having you help guide people in these rural areas, do you see a lot of that from the rural areas, or are you seeing more from city centers and more the urban clients?
No, I think you got it right as far as geographically. A lot of our, especially manufacturing clients, are throughout the Midwest and lots of rural areas there. And part of it is food accessibility, but also just knowing what to choose. I did this once where I went into a manufacturing office and I brought Qdoba. And there's a couple reasons I did that. One, like meet people where they're at. And also, I wanted to show that our nutrition methods can be done anywhere. So they weren't it wasn't daunting to them to get started. And I showed them how to balance their plate. Now, obviously, we're not recommending eating fast food all the time, but like life happens, right?
Yeah. Yeah. Well, and for people who are doing a lunch and learn, right? I've been guilty of this. I'll do a lunch and learn for a company on something culturally, and I'll grab what's available, fast food or restaurant wise in the local area. And it's not always the most healthy. And to just know how to balance that plate based on what's available, I think is a big deal.
Yeah, you'll feel better in the afternoon if you balance your lunch.
All right. Well, I'm going to have to learn how to do that. You and I will have a
I'll
separate
send you an
conversation.
article,
All right.
a link about the root plate.
Perfect. If you do, or when you do, and I'll then link it in the article or in the notes below. So I want to shift gears a little bit, because you wrote a book. You literally wrote the book on PCOS. I hope I'm saying that.
You did.
And the thyroid connection, right? So what is that?
Mhm.
Let's start there. What is that, and how does it affect people every day?
So PCOS is polycystic ovarian syndrome. It's the most common hormonal disorder in women of the childbearing years. It's very underdiagnosed. It takes women sometimes over 2 years to even arrive at a diagnosis for why they haven't been feeling well. And yes, and then the thyroid is typically in the US, the most common thyroid condition is an autoimmune condition called Hashimoto's, and it causes low thyroid. And so people often need to take thyroid medication for that. And this is one of these things where the root model just kind of unveiled this to me, like starting with data. In our lab panel, we were picking this up along with people's symptoms and clinical picture. We were picking it up right away. And because we had so much data, I was realizing that it was so common to have both of those conditions together. I think I published this book 4 years ago now. So it's caught on, like the trend is caught on. People realize like if you have a hormonal disorder, make sure your thyroid's checked and like vice versa. But then we were like, what is connecting them? And this is where the functional medicine part came in because we dig deeper into gut health and we know that autoimmune conditions can be triggered in the gut and the gut microbiome. And actually now PCOS has some evidence that that may be related as well.
Interesting.
And we were finding like common microbiome imbalances or common root causes that were connecting the two. And when we started using our own clinical methods and treating this, we were having amazing results. Women were getting pregnant after they failed IVF because PCOS can cause infertility
Wow.
issues. We were reversing all kinds of other symptoms that, were seemingly unrelated. Hormones were coming into balance, skin was clearing up, hair growth improved. And energy levels and mood improved, and the whole cascade of symptoms that otherwise might be very siloed in conventional medicine, like here's a pill for that and an antidepressant for that. And, maybe none of these things are related, but they actually are. And so that's the whole point of finding the root cause. When you treat that, a lot of other symptoms get better too that you might not have known were related.
No kidding. Well, okay. So this may be an unpopular take or a hot take. I don't know. You can tell me, you're the expert here. I'm just the husband of a woman. Historically, and what I see with my wife, it seems like women are misdiagnosed a lot. And even things like perimenopause, right, are kind of swept under the rug. And oh, you're just and so how does functional medicine kind of eliminate that dynamic, I guess, of telling a woman she's crazy for feeling these things or having these hormonal fluctuations and all the things that historically we've just said, no, here's a pill, take that, and it's not really what you think it is, type of a thing.
And you're not wrong at all. That really happens
Okay.
to this day. It's happening all the time, which is unfortunate. And how functional medicine helps here is a number of ways. Again, one, we give people access to testing that they may have been denied in the past because, like you said, oh, just take this pill, or that's normal part of aging. And then we show people like, actually, there is some imbalances here, and these are some things you can do to help based on your data. And the second is listening to people. We're not in a rush treadmill situation in our practice. Like, you can ask us questions. You can have the same doctor and dietitian if you like us, and we'll follow up with you.
Got it. Okay.
So that continuity is really helpful too, because it's not like just a one and done, brushed off and no follow up. If you're not better, we want to see you again. Or even if you are improving, we want to see you again because we want to keep you well.
Yeah. um Again, maybe a hot take, but that's okay. I like those. There are most of the European countries and other developed countries in the world have, single payer or universal health care. And in your opinion, and again, you don't have to answer any question you don't want to if you feel like it'll get you in hot water. How much is our healthcare system, the way that we have insurance set up in this country, driving some of the misdiagnoses that we have and some of the things that you drive to try and make better in the healthcare system?
Yeah. Thanks for giving me an out on this one, but I'll take it.
Okay.
This
Okay.
is definitely a hot topic. I think that the incentives being aligned is important. The time that you have with people, what things are reimbursed and how they're reimbursed. I mean, we would almost be like ignorant to say that wasn't part of it. Like that's part of it, right? And that's one of the reasons that people don't have time. Or even if you combine that with the way our medical training is set up, This sounds crazy, but I was never taught to find root causes in
Really?
medical school. No, I was taught to diagnose things and what things to order and how to treat those things, but
Yeah.
I was never taught to go upstream until I went to functional medicine training. And so you're looking at, to be a family doctor, it took 11 years, I think, or something like that. 4 years of undergrad, 4 years of medical school, and then 3 years of residency. And if you think about undoing like 9 to 11 years of training on a system-wide level, like that's really hard to do. And you get so ingrained into this system. And it's also hard to change. And so what we do at Root is we actually, instead of trying to change the entire primary care field, we just layer right on top of it. Like primary doctors do wonderful work on acute things, on getting your screenings done, on when you do need a referral. Like that system could work really well. It's the chronic condition part that
Got it.
is the biggest problem because nobody's looking to de-escalate medications or de-escalate referrals. Those things are kind of like good for the system. So we come in there and be that chronic condition specialist to take that burden off of the
Yeah.
primary care system.
Do you think the healthcare system's broken in the US?
Well, I think there's definitely room for improvement. I'll be positive about this because there was something announced yesterday, actually, by CMS, which
Okay.
is the Centers for Medicare and Medicaid. And there's public funding there now to do, as of yesterday, this was announced, to do more root cause or functional medicine. I've never seen functional medicine like be part
That's
of a
awesome.
national announcement. So this is like such good news for this type of care, and that it's not a fringe thing anymore. It's becoming mainstream. It's
Very
even
cool.
maybe being supported in policy. And so we're getting there.
Yeah.
And I'm happy to be on this journey to
No,
help.
I love that. This is my last question, or second to last question. What kind of a future do you envision for people inside this system in the US?
Well, in my mind, after running Root for years, I envision a system where everyone has a chronic condition specialist or a root cause specialist laying in there as a very important part of their benefit structure. I think that's the most effective and efficient way to solve the chronic condition crisis, is to layer in that person who is trained and has the right care model to address 90% of healthcare costs, which may only be coming from 20 or 30% of your employee population, but finding those people and giving them that access to us is going to be key in reversing our healthcare cost trend, and also bringing it back to your culture, happy, healthy people who have the
Yep.
right care.
I love it. That's a great way to wrap this episode. So I'm going to ask you, Erica, what I ask every guest at the end, because we don't know what we're going to talk about. Was there anything I didn't ask you that you wanted to share with the audience today?
Well, maybe just how to find us.
Yeah.
I don't know if
How
that
did
was
I
coming
forget
up.
that one? I totally spaced on that. Where can
No,
people
no
find
worries.
you?
Medicine.com. And we have a For Employers webpage, and there's a contact form on there. If you fill it out, we'll be happy to schedule a demo and see how we can help your people.
Awesome. And we'll schedule a demo for my other show. I'm super excited for that. Erica, I love what you're doing. I love this idea of root cause on the health side. I think that alone will resonate a lot with the audience today. It was just a really good conversation. You sit at that like intersection of health worker and employer employer responsibility, but also with the future of American productivity, because what you are enabling people is to work healthier and happier and be that healthier, happier employee. So thank you so much for your time today. Thank you for being on. I love this conversation, and I hope everybody else did too.
Same. This is one of my favorite podcasts I've done. So thank
I
you.
love that. You just made my day.
Yes,
Awesome.
you're such a good interviewer. So I don't know if that's going to be included in the track, but I want